question. First question, a truck driver came with painful ulcer and lymph nodes. History of unprotected sex present. Choose the correct clinical condition. Choose the correct clinical condition. See carefully here. We have 4 choices. All are sexually transmitted infection. All are due to unprotected sex. All are due to unprotected sex. Okay, just a minute. Okay, I'm sorry. Right. So, donovanosis. It causes beefy red ulcer, usually painless. When it is have the infection with secondary bacterial infection, it may be painful, but it is painless. Chancre, here it means syphilis, hard chancre, it is painless. Herpes is usually painful, but its main presentation is blister, then lead to ulcer. And lymph nodes, very important, painful lymph nodes we can see in chancroid. I can go for chancroid. It is caused by Haemophilus ducreyi. It causes soft chancre. Painful. It is painful. Remember my mnemonic? Yes, 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 AX. It is safety pin appearance. School of fish. Arrangement. And soft chancre, otherwise called chancroid. It is painful. Hemophilus, do you cry? Do cry. Painful. And drug of choice acithro. It need growth factor 10 only. This is my regular class mnemonic. You people aware of that. Okay. Next is patient came with fever and chills. Peripheral smear shown in the image. Choose the pathogen. Fever and chills, you need to think of Plasmodium, and all Plasmodium they gave. So your diagnosis is correct. You are going in the right path. See the picture. Multiple rings. Multiple rings. We call it as Acol formation. I used to tell, wherever you see the multiple rings, Acol formation or banana shape or boat shape gametocyte, close the file. It is Plasmodium falciparum. It is Plasmodium falciparum. Think of Plasmodium falciparum. It is nothing but Plasmodium falciparum. Because of Acol formation. Acol means multiple rings. Signet ring or what's called smiley appearance. It gives smiley appearance or signet ring appearance. Standard terminologies. Signet ring or smiley appearance. Like this, see here exactly. Smiley appearance. E like this. Next is diphtheria toxin mechanism of action. Always you should have a mechanism of action of exotoxin. Don't worry. 100% one question will be there. Very expected question, very easy question. Diphtheria toxin mechanism of action. It acts on elongation factor to inhibit protein synthesis. Same kind of things you can see in one more also, Pseudomonas toxin. Pseudomonas exotoxin A. 60S ribosome is Shiga toxin or virotoxigenic E. coli toxin, enterohemorrhagic E. coli toxin, increasing cyclic AMP, many people, anthrax toxin, cholera toxin, pertussis toxin, many people, even E. coli label toxin. Okay, yes, Arbar, you're right. And decreasing cyclic GMP, not decreasing, increasing cyclic GMP, you can see in E. coli stable toxin. So whether it is INICET exam or NEET exam or FMGE exam, subject is same, and definitely you may get a question on this, no doubt on it, 100%. All toxins under one slide I already posted in my group. My group is Micro Magics. You people aware of that? All toxins available there. Just you can go through this. Okay. Next is vector for scrub typhus. Another important question. 100% you can get vector. Some questions are 100% questions. Mechanism of action of toxin, vectors, hepatitis B serology, those kind of things are 100% sure questions. Vector for scrub typhus or Orientia Suzugumushi. Some people said Orientia Suzugumushi, some people send the message scrub typhus. People got excited, correct answer. So they forgot the question. They say my answer is right. What is it? So it is thrombocycloid mite is the vector. Flea is the vector for rat flea is the vector for endemic typhus. And plague. Louse is vector for trench fever. Epidemic typhus. Epidemic type of relapsing fever. Tick is vector for many things. Lyme disease. Babesiosis. Many things tick is the vector. Ehrlichiosis. Tularemia. Many things this is vector. Tick is the vector. KFD. Caseous forest disease. Many things. Okay, hope this is very easy question. Direct question. And fully expected question. Outbreak of diarrhea. I don't know the full question. I got only keywords. Rice water stool in nature. Many people directly mentioned cholera. Sir, one question came from cholera. I got the message. I don't know what question. After that, slowly explode. Some kids sent. Sir, darting motility mentioned, sir. So, rice water stool, darting motility. Think of Vibrio cholera. Okay. Culture media. What they shown is TCBS agar. It produces yellow colonies due to sucrose fermentation. Due to sucrose fermentation, it produces yellow colonies. So it's Vibrio cholerae. Because Shigella dysentery produces bloody diarrhea, bacillus dysentery. Rice water stool, outbreak, darting motility, that is important. Darting motility. Okay, darting motility. Is you can go for this one. And the colony morphology is rightly mentioned by this one is oil drop colonies. It produces oil drop colonies. Next is normal flora of conjunctiva. You should know about all normal flora. For example, skin and conjunctiva. Normal flora is Staph epidermidis. Staphylococcus aureus seen in nose. Normal flora in the nose. Staph pyogenes pneumonia, usually they are not considered as normal flora. It may be seen in throat. Possibilities are there. In case of female genital tract, vagina, normal flora is lactobacillus. Lactobacillus. Throat, Staph viridans. Intestine, bacteroids, E. coli, like that. So you should know about normal flora. Even Staphylococcus also present in eye, but 80% the normal flora of conjunctiva contains Staphylococcus epidermidis. Coagulase negative Staphylococcus, mainly Staph epidermidis. One more, Staphylococcus albus also present. Next is, yes Anit, you are right. Peripheral smear shown in the image reveal the diagnosis. Choose the correct treatment. See, already told where you can get typical banana or boat shaped gametocyte, you can think of banana or boat shaped gametocyte, think of Plasmodium falciparum. Any uncomplicated malaria as per WHO guideline we should give for artemisinin based combination therapy, shortly called ACT. Primaquine for Plasmodium vivax to attack hypnozoites. Chloroquine was ancient therapy. That time, now we develop resistance to chloroquine. Okay, there's a big list of drugs are there. Artemisinin based combination therapy. You are all aware of that. This is called ACT combination. Artemethyl-lumefantrine or artesunate amlodipine, artesunate mefloquine or artemisate sulfadoxine pyrimethamine. Those kind of drugs. These are all artemisinin based drugs. Good. You people beautifully answered. Next is 45-year-old male patient present with fatigue and tiredness. He had low hemoglobin reticulocyte count. Bone marrow reveals erythroid precursors. If anything affect erythroid precursor, important pathogen is parvovirus B19. It attacked the erythroid precursors, parvovirus B19. It causes fifth disease. Okay, what it usually causes, especially in sickle cell patients, it causes pure red cell aplasia because no erythroid precursors. Pure red cell aplasia. Hemolytic anemia, it may cause in fetus, fetal hydrops. Pure red cell aplasia. Yes, Hanid, you are right. Pure red cell aplasia. Next is HIV positive, PLHIV low CD4 count. I don't know what count they mentioned. Some people mentioned less than 200. I'm not sure because I got the message like this. Admitted with pneumonia. Gomari methylamine silver nitrate they mentioned. It's a fungal stain. What is the image? You can get broken ping ball appearance. Broken ping ball, HIV positive, pneumonia. Most common cause of fungal pneumonia in HIV positives, PLHIVs, is Pneumocystis cerevisiae. Some people mentioned treatment also. And some people have mentioned, sir, they are not giving this picture. They gave X-ray picture with ground glass opacity. I am not sure. You people should tell because you attend the exam. You tell in the chat box, sir, if it is X-ray, I can put X-ray. And I hope medicines are also discussed. Yesterday we discussed with all the questions with other faculties that the medicine sir said X-ray. So he discussed X-ray based question. I am discussing microscopy based question. We got the same question with the two different variety. I don't know whether morning batch and evening batch they have different questions they had. I mean morning paper and evening paper they have different variety. I don't know. Okay, you people should clarify. Okay, so it is pneumocystis and some people mention treatment also. Treatment means you can give cotrimoxazole. If they ask what is the organism, pneumocystis is the organism. If they ask what is the treatment, cotrimoxazole is the treatment. Cotrimoxazole is the treatment. HIV positive bacterial pneumonia, streptococcus is common, my dear. But in case of fungal pneumonia, common is pneumocystis. What type of pneumonia is important? Interstitial pneumonia, lobar pneumonia, that is important. In case of consolidation lobar pneumonia, bacterial pneumonia, go for streptococcus. In case of interstitial pneumonia, it may be cytomegalovirus. Many people are there. Next is Kaposi sarcoma present in which CD4 count? So you should know about CD4 count and this thing. There's a beautiful picture is there. See here. See my picture. This is already I posted in the group. Same picture. So I can take the picture for your reference. Already there in the group. You can easily answer. Same picture I have posted in the group. CD4s and opportunistic infections. See here. CD4 count, if it is less than 500, Kaposi sarcoma, lymphoma, all those people. If it is less than 100, you can get cryptococcus, MAC complex, progressive multifocal leukoencephalopathy, those kind of people. Cryptosporidium, isospora, microsporidium, those kind of people. Okay, so CD4 cell less than 500 usual pathogens, 500 to 200 usual pathogens, more frequent or severe, like that. Just to go through this. Okay, so Kaposi sarcoma present, in which CD4 count less than 500. Less than 500. Okay, next is, after seeing the picture, easily you can answer. Direct question. After seeing the picture, this is called owl eye inclusions. Over. What else you want? Such easy paper. 65-year-old pale HIV patient came with cough, fever and pneumonia. Biopsy shown in the image. It is 100% you can vote for. Owl eye appearance is cytomegalovirus. Cytomegalovirus. Owl eye appearance, cytomegalovirus. Yes, honeydew, correct. These are all just like that you can answer the questions. Next is, patient with bloody diarrhea, flask shaped ulcer. That's all. It gives Entamoeba histolytica. And it is due to quadrinucleate cyst. Yes, now you are diagnosing it is Entamoeba histolytica. Okay, something related to this is, what is the appropriate treatment? Appropriate treatment is metronidazole, tinidazole, those kind of people. Yes, we want metronidazole, tinidazole, those kind of people. So what our people do, they will confuse in the exam mebendazole or metronidazole, all looking similar. It will confuse in the exam. Relax, you can answer. It is metronidazole. It is metronidazole. Chloroquine we can give only for extraintestinal amoebiasis. Extraintestinal amoebiasis is chloroquine. Albendazole, mebendazole we are mainly giving for helminthic infections. Helminthic infections. Intestinal nematodes like enterobius, trichuris, ascaris, ankylostoma, all those people. Okay, next is, identify the pathogen. I don't know the question, but they already told, sir, this picture gives a picture. The people send the picture. Same picture they send, sir. They made this thing, but I don't know what organism. I don't know the question. Some skin lesion or some nail lesion, something is there. They told, but I am not able to get exact. We will refine again based on your feedback, based on your inputs. Okay, definitely we will refine. We will make a correct set of thing. So you can get no microconidia. And flask shape, club shape macroconidia. Suggestive of epidermophyton, because trichophyton, pencil shape macroconidia, lot of raindrop microconidia. Where microsporum, it is having typical spindle shape macroconidia. Microconidia may be plus or minus. Epidermophyton, club shape, and no microconidia. No microconidia. That's all. almost we have collected 14 questions from the list. Any questions if I missed, don't worry, you just contact me in the group Micromagics or in the chat box, or personally you can message me, no problem. We will rectify, we will add or delete the options which is correct given by you. Paper is really very 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 easy paper, no doubt on it. Okay, with this I'm completing the discussion. Thank you very much.